Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Today we're going to start talking about a brain MRI, and this is going to be our first lecture on how to read brain MRI. This lecture is going to be mainly an orientation about the brain MRI, the sequences of the brain MRI, the cuts of the brain MRIs, and what is the importance for each cut of the brain MRI. As you guys see here, a brain MRI is extremely helpful for evaluation of the brain for any acute or chronic process. There is a different cut for the brain MRI. As you guys see, there's a T1 cut here, axial in this case, where the white matter is white and the gray matter is darker. And this is the white matter, and this is the gray matter here. Next to it is T2 sequences. This specific cut is FLAIR image, where the white matter is dark and the gray matter is lighter than the white matter. Also, the fluid signal, as you see here on the FLAIR, is wiped out, so it does not look bright as in the classical T2 cut. In the classical T2 cut, the fluid signal is bright, as you see here. This signal in the FLAIR image, it will be wiped out, so you have more clear image of the gray white matter. These are the main cut for the brain MRI. There is also more cut that are used in the brain MRI regularly. These cut like diffusion weighted images. These are the cornerstone cut that we use to diagnose acute stroke. And as you see here, acute stroke or restricted diffusion would look bright. This is the ADC mapping, and if the restricted diffusion is actual, it will be bright in diffusion weighted image, which we call it DWI, and it would look dark on ADC mapping. If it is T2 shine through, as in the case of inflammation, you will see it as bright in diffusion weighted image and bright on ADC mapping, which help differentiate T2 shine through from restricted diffusion. There's also more specialized cut that we use to detect any bleeding, like a gradient echo T2, and as you see here, the blood would look dark on this cut. So any dark spot in gradient echo, as in this case where you see the arrows, it would indicate bleeding, and such cut would be very helpful in case of acute bleeding, and in cases of chronic bleeding or hemosiderin deposition. A classical example for that is superficial hemosiderosis that is mainly seen in the adult. There is also more fancy cut called susceptibility weighted image, SWI, which is claimed to be even more sensitive to diagnosis of bleeding. As you see here, dark spots. These dark spots indicate there is bleeding, regardless if this bleeding is a chronic or acute. As a rule of thumb, if it is dark in T2, bright in T1, it's bleeding until proven otherwise. I'm going to talk now about the MRI cuts. Now we talked about the sequences. We're going to talk now about the MRI cuts. The cuts are the classical axial cut, which is the horizontal cut, as you see here. And there is a sagittal cut, which is vertical front to back, and coronal cut, which is vertical left to right or right to left. And each cut is helpful to look at certain structures of the brain. This website, head-neck-brain-spine-MRI.com, is extremely helpful, as it has brain modules or neuromodules where you can just point to the where you can point to the structure, and it will tell you at the bottom what is the structure. So here I am pointing to corpus callosum, and at the bottom you can see that it will tell you that it's corpus callosum. Now, if you look at the sagittal T1 cut, remember T1, white matter would look white, gray matter would look gray or darker, fat would look white, bone would look fat like here would look bright, bone like here would look dark. This is the bone marrow here, as you see. This cut is extremely helpful, and to look more specifically at certain structures. One of the classical structure we look at on the sagittal T1 is basically the corpus callosum. You see here, I am pointing, the corpus callosum has 4 parts, pointing to the rostrum of the corpus callosum. Here there is the genome of the corpus callosum. Here there is the body of corpus callosum, and here is the splenum of the corpus callosum. So on sagittal T1, it is extremely important to look at the corpus callosum and its 4 structure. First, you have to look if it is absent or present, especially in pediatric, and if it is present, is it thick, normal thick, or is it very thin, which indicate bilateral hemispheric dysfunction, as in the case of brain atrophy. It is also very important to look at it in the adult, especially in demyelinating lesion, as in the case of multiple sclerosis, and also sometimes you can a certain tumor like butterfly, glioblastoma multiforme can cross the midline through the corpus callosum. Another structure, key structure to look at it on the sagittal T1 is the vermis of the cerebellum, as you guys see it here. You need to look if it is absent or present, and also you need to look if it is normal or if it is atrophy, especially in kids brain, and it's also very important in the adult. Here you see the anterior cerebellar lobe. Here you see the posterior cerebellar lobe, and here you see the vermis. This part is the midbrain and the tegumentum of the midbrain. This is the tectum of the midbrain. I am pointing to. This part is the inferior colliculi. This part is the superior colliculi. You also need to look at the pons, or what we call the pregnant lady, to see if it's normal, if it is hypoplastic, or does it have atrophy. A classical finding, for example, in congenital disorder of glycosylation is pontocerebellar atrophy. You will see atrophy of the pons as well as atrophy of the cerebellar vermis and the hemisphere. And down here you need to look at the medulla oblongata. Remember, the brainstem is a more reflection of how many cells, or how intact are the tracts that are coming from the cerebral cortex down to the spinal cord. Another key structure to look at it in the case of sagittal T1, you need to look at also the clivus, as you guys as you see here. This is the clivus. It's very important to look at it, as a certain tumor like a clivus chordoma can be seen here. This is the sella torsica, and usually you will have, and you see here the pituitary gland, and usually the posterior pituitary would look bright normally in T1, which is the posterior part to pituitary gland. Also, remember when you look at the MRI, you are responsible to look at all parts in the MRI. So you need to look at the calvarium here, or the bone, and if there is any abnormality that draw your attention. On top of that, also, as you guys see here, you see the vertebral artery, and if you go up a little bit here, you see the basilar artery. It's also important to look at this structure because sometimes you will see a dilatation of the basilar artery or abnormal dilatation. Sometimes we see thrombus in the basilar artery. Here you guys see beautifully the vertebral artery, and the more we go lateral, as you can see from here, from the coronal cut, you will see the cerebral hemisphere. The cerebellar hemisphere, I'm sorry, the cerebellar hemisphere. You can also see here the eyes, and of course you can see here the internal carotid artery. And as you navigate lateral, you can also see you need to continue to scan if there is any abnormality, whether in the brain or in the cortex, or sometime if the cut involve the neck, you need also to look at the neck, specifically the throat, the posterior pharynx, as well as the thyroid gland, which sometimes can be included in this cut. Another important structure also would be helpful to look at in this case is basically the, as you guys see here, the optic chiasm. Would be helpful to look at it. Here you can see the fornix as well as the anterior commissure, and you also here see the mammillary body. You navigate all the way to the extreme left, then all the way to the extreme right. And you see here the anterior carotid artery anatomy, beautiful and very clear. Then you go all the way to the extreme right, looking at the same structure and looking at the whole brain MRI. Now another cut is axial T1. Basically on T1, the most important thing you can see the anatomy the best on T1. So here you see the cortex, and in this case we are looking at the parietal lobe. Here we are looking at the caudate nucleus, and here the putamen. This is the geno of the internal capsule. This is the anterior limb of the internal capsule, and this is the posterior limb of the internal capsule. And also you see here the thalami bilaterally. Here you see the atrium or the trigone of the lateral ventricle, and this is called peritrigonal area specifically, and the green area here is called the temporal lobe. Here on this area is what's called Sylvian fissure. It can be very prominent in certain disorders of metabolic disorder or congenital disorder. And as we go down, you can still see here the middle cerebral artery, and you see Mickey Mouse here, which represent the cerebral peduncle attached to the midbrain, and this red structure is called the red nucleus. And as you go down, you see the cerebellar lobe start to show up as horizontal lines. And as you go down here, we are seeing the pons. Here the middle cerebellar peduncle. and as you go more down, you come down to the medulla oblongata. This cut specifically is made with contrast. As you see, the anterior carotid artery or the vessels are taking the contrast, and as you go up, you see beautifully, we are here seeing the anterior carotid artery in the cavernous segment, and it goes up, up, and at this time it would give the ophthalmic anterior carotid artery, but it would give the ophthalmic artery. And as you go up, you come to the supraclinoid signal, and then you go to the middle cerebral artery. And here you see the optic chiasm nicely, and here you see the mammillary body nicely. As we said, T1 is extremely important for anatomy in the pediatric neuroradiology. So you can see clearly if there is any evidence of migrational abnormality. And of course, you, as usual, you are responsible for the whole brain MRI. You look at, so you need to look at the calvarium. You need to look at the eye if there is any abnormality. And here you see the muscles of the eyes. Then as you go as you go up, I'm sorry, you will. You can see here the optic nerve bilaterally. Here the optic nerve and here the optic nerve. And you see here the vertebral artery bilaterally, and as you go up, they would cross and approach to form the basilar artery. And as the basilar artery goes up, it will give to branches, which are two branches at the posterior cerebral artery. Unfortunately, they are not very obvious here in this cut. Now to go back to the coronal section. Coronal section is very helpful to look at the brain MRI. Also, if there is any atrophy, it would be very obvious here. And you see also, you look at the cerebellum, if they are two lobes or if they are attached together, as in case of rhombocephalosynopsis. You also can appreciate if there is any ventricular dilatation. And you see here, guys, the middle cerebellar peduncle. Here you see the lateral ventricles, and here the third ventricle, and here you see the quadrigeminal cistern. Of course, as you need to keep looking at the whole brain MRI. This is bilateral the vertebral artery. This is the medulla oblongata, and as you go up, it's the pons. These are the middle cerebral peduncle attached to the pons. Remember, the middle cerebral peduncle are attached to the pons. The superior cerebral peduncle between the midbrain and the cerebellum, and the inferior cerebellar peduncle between the medulla oblongata and the cerebellum. Of course, also you can see here the course of the anterior carotid artery, showing very nicely. You can see here also the optic chiasm, very nice. And in case of pituitary protocol, they do more thin cut through the pituitary gland, and it is extremely helpful, the coronal cut in such cases. Here you can see the infundibulum. It is also very important to see if it's midline or deviated in cases if you are suspecting pituitary adenoma, microadenoma, or pituitary tumors. Now, as we go forward, you can see here the optic nerve very nicely. The muscles of the eyes, medial rectus, lateral rectus, superior rectus, inferior rectus. And as we go forward, as we keep going forward, one of the structures that can be seen better on T2 is the first optic nerve. It will be seen at the bottom here, but this will be more appreciated and better appreciated on coronal T2 images. Again, you really have to also keep looking at the whole MRI, and in most of the cut they might provide a better view of the sinuses. Here you see the sphenoid sinuses, here, and you need to comment on that if there is any abnormality on the sinuses. Here the sphenoid sinuses, here the maxillary sinuses, and you definitely need to comment on that. And here the frontal sinuses are shown very beautiful. Most of the MRI cuts would be more it would show more parts of the sinuses as well as of the cervical area. This would conclude the first part of our series of how to read the brain MRI. I just want to tell you it is really important to read MRI and get used to know the MRI cuts and the structure, as you need to know first what are the structure you are looking at. Second, if the structure you are looking at is normal or abnormal. And third, if the structure you are looking at is abnormal, you need to know if this is abnormality is a normal variant or if it is a pathology. And if it is pathological, you need to know how to provide a differential diagnosis. Key point, you need to focus on the whole MRI, not just on the brain. It's a given you need to look at the brain and comment on any abnormality. But remember, whatever shown in the MRI, like the sinuses, the vessels in the MRI, if there is any part of the neck is obvious, or the calvarium, you definitely need to look at that and get used to look at that, as looking at that can lead to catastrophic abnormalities. My name is Dr. Alsayouf, consultant child neurologist, and this concludes lecture 1 of how to read a brain MRI. Please visit us at www.americanchildneurologyuae.com and look at the video section. This lecture will be uploaded there for you guys to review, and I look forward to start the part 2 of the brain MRI. Thank you and have a good day.